Hi, welcome to our channel Clinical Pharmacy Lectures. Let's start our questions and answers. Describe the mechanism of action of neuromuscular blocking agents used in the ICU, and name one example. Neuromuscular blocking agents block nicotinic acetylcholine receptors, leading to skeletal muscle paralysis. Vecuronium is a non-depolarizing neuromuscular blocking agent commonly used in the ICU. Explain the rationale for using therapeutic hypothermia in patients following cardiac arrest. Therapeutic hypothermia aims to mitigate neurological injury post-cardiac arrest by reducing metabolic demands. Typically, a range of 32 to 36 degrees Celsius is targeted. Potential complications include infection, electrolyte disturbances, and cardiovascular instability. A patient admitted to the ICU develops acute kidney injury. Lists 3 nephrotoxic medications commonly used in the ICU and describe their mechanisms of nephrotoxicity. Common nephrotoxic medications include aminoglycosides, vancomycin, and contrast agents used in imaging. Aminoglycosides cause renal tubular damage by accumulating in proximal tubular cells. Vancomycin can cause nephrotoxicity via direct tubular toxicity or in combination with other nephrotoxic agents. Contrast agents cause renal vasoconstriction and direct tubular injury, particularly in patients with pre-existing renal impairment. Discuss the pharmacologic management options for the prevention and treatment of delirium in critically ill patients. Pharmacologic options include antipsychotics like haloperidol and quetiapine, and alpha-2 agonists like dexmedetomidine. Non-pharmacologic approaches include minimizing sedation, promoting sleep hygiene, and early mobilization. What are the key considerations in the use of insulin infusion therapy in critically ill patients, particularly those with diabetic ketoacidosis or hyperglycemia in the ICU? Close monitoring of blood glucose levels, adjusting insulin infusion rates based on glucose trends, and preventing hypoglycemia are critical. Achieving glucose control within target ranges improves outcomes and reduces complications associated with hyperglycemia in critically ill patients.